Hello and welcome to another wonderful episode of your favorite talk show on Serenity TV, where we'll have unfiltered, interesting, and honest conversations. My name is Gloria Uchina, and today we are having a very interesting topic that deals with health and healing. Today I have interesting guests in our midst, experts in the field, actually, a beautiful guest at that, to help me unpack this wonderful topic today. In the presence of,
Okay, Dr. Ekene Ahaneku.
you're welcome, sir.
Thank you.
Okay, I'm Dr. Paraji Chimduto.
You're welcome, ma.
I'm Dr. Kate Amaku.
You're very much welcome, ma. Seriously, I'm thrilled to have you guys here today. It is wonderful having you here. You're welcome. So today we'll be discussing postpartum disorder. Let's start from the basics, Dr. Ekene. What exactly is postpartum disorder?
Okay, yeah, postpartum disorder and it is a mental condition that is popularly known as postpartum depression. So to most people, they prefer when you call it a depressive episode or maybe a series of depressive episodes that happen to a woman who just gave birth to a baby. And most times it goes beyond what we as well call baby blues. Just like some people can call it baby blues, but it goes beyond it because most times it happens beyond 2 weeks after childbirth. So it is a serious problem that most women suffer and it needs urgent attention, especially in our society where vast majority of people believe that it is only when somebody has gone mad that they can seek the attention of a shrink. So if a woman who is being overwhelmed by some activities, by some factors, family issues, and a lot of other factors, they can actually come down with postpartum depression or disorder.
All right, thank you, sir. Do you have anything to say in regards
Okay,
to
yes. In addition to what he has said, I would say it's a spectrum. Where we have the mildest form being the baby blues, as he talked about, and the more severe form being the postpartum psychosis. Then the postpartum depression is like yes, they're all like an all encompassing thing, but like a spectrum. So the baby blues happens just a mild one. It happens within some days after birth, but wears off within like 10 to 14 days after birth. Then the postpartum depression, happens up to 1 to 2 years after birth. But the psychosis is now the more severe form. But why this topic is very, like when I talked about it at work, I'm a pediatrician, so I talked about it with nurses. I have something coming up. They were like, it's very, very important. And most of the nurses gave me their stories. And I myself, I'm even like, I don't know if I can tell my story now.
Yeah, you can.
Yeah. So I got a job at FMC in August 2020, and I gave birth September. And because I wasn't due for maternity leave, I resumed. They didn't even give me maternity. They didn't give me any time. And I would say I had some form of baby blues. You understand? But what kept me going then was I had a very supportive family. My parents were at my beck and call. They took over my baby from me. So I was worried then. I was worried, who will take care of my baby? How will I breastfeed my baby? And I'm pediatrics. And then I was supposed to resume a very stressful unit. I kept on thinking, I was worried. I was always crying. I was very tearful. I was anxious. But I didn't get to depression. And what kept me from getting into that was because I had family. So that's where, when we get towards the end of our talk, we talk about what the society can do. I had very supportive parents. I had very supportive people at work. At point, my consultant there, Professor Wonisa, gave me 1 month, say, go and sort yourself out. And that 1 month he gave me helped me a lot to like really adjust. Imagine I started a new job August. I had a new baby September. It was a whole lot for me. I was overwhelmed, but having the people around me really kept me going.
That's wonderful.
Yeah.
Do you have anything to
Okay,
contribute?
thank you. Yes, actually, I want to add to what you have already said. Like I was so happy when Dr. Chimdoto talked about and really differentiated between baby blues and depression. Yeah, it's like some people like mistake baby blues to depression. That's the truth about it. Baby blues is just actually a short time period, unlike depression. Like she said, it can even last for like 2-3 years. Like I have a case, my case. Let me use myself. After my first baby, mine lasted for like 4 years. I must say 4 years. Yeah, 4 years in a sense that thank God, like you said, thank God I had a supportive family that was there for me. But like emotional crisis, emotional stress can actually doesn't take you very far from where you expect. Actually, then it was emotional stress I was going through. You understand? Added to depression, the depression itself. The depression is far from what we actually see. Some see women that gave birth nearly as, what are they even thinking about? They have a lot of things bothering them. In fact, in our society today, we look at the pregnant women that maybe, we have depression before I can say prenatal depression anyway. That one is something that is common. But postnatal depression can, like my colleague said here, you can go mad. So in the community, we see it as is when you go mad, and when you need psychiatric case.
That's
Maybe
when
that's
people
yeah, that's when we now look
yeah.
at it as this person actually needs help. It's actually something that we in this community, in this environment, really need to look at
All right.
seriously. Thank you very
All right,
much.
thank you very much. Now, this postpartum disorder, it is something that a lot of mothers, like you said, are battling with currently, or some are still battling with it. But most of them don't actually know the causes. After childbirth, you just have this different kind of attitude and everything. And the most part of it is most of them don't believe there's something wrong with them. They don't believe there's something wrong with them. But looking at it, the emotions and everything becomes overwhelming. Now let's talk about the cause. What exactly are the causes of this postpartum disorder?
Okay, I think generally, most times when we have some diseases in medical school, some lecturers will always say the causes are unknown. But in this case, a vast majority of things can cause it. So there is no single thing that you can say that causes it. But these things now are intertwined into, a combination of physical, emotional, and social factors that can predispose a woman to this. Like my colleague said earlier, that some level of stressful life events can actually predispose women to this. And most times you have ladies who are about to give birth to their first kid. They are really excited about the whole process, but they start thinking about the whole imposter syndrome that happens within our day-to-day living in our career, and all of that comes in. They start questioning themselves. Am I actually up to the standard needed for a mother? Am I going to be able to be a good mother for this baby? Am I able to, do what this baby wants? Will I actually live up to the expectation?
So
All
much
these things can
questions.
actually make them break down. And sometimes some level of hormonal changes can actually predispose them to this particular problem. And some people, I think you mentioned that earlier, some people who have prehistoric or history of depression or anxiety pre-pregnancy period can actually come down with a PPD. So these things are some of the things that we can look around and say, okay, this can be the causes. But it goes beyond this. There are a lot of other factors. Just like I said, it could be physical, it could be emotional, it could be a social factor.
Wow.
So it's a lot.
Wow.
Okay, that's just like to buttress what he has said. The causes are unknown, but there are things that we call risk factors for that. So when talk about is a combination of things. We could have hormonal, as I said, environmental, social factors. Now, when it comes to hormones, when a woman is pregnant, there is an increased level of some hormones we call estrogen and progesterone. Now, once a woman puts to bed and the baby is out, there's a sudden drop in that hormone level in the woman. Another very important thing is also a social factor. A woman who is having marital issues, maybe maybe a single mom, or maybe a woman who has issues with her husband, maybe domestic violence, they are very high risk of having postnatal depression. A woman who has had maybe a previous death of a child, she has lost a child before. I had one time. She was an immigration officer at Ibadan. Oh, sorry, I'm not supposed to be so specific. But she was transferred to Wiri. She has had 4 fetal deaths. Wow. So that fifth one she had came out very. This happened last year. Came out very a preterm, and that woman kept on having episodes. Sometimes it was like she beat 3 security men in the ward. But when we invite the psychiatry unit, tell us that she's fine. This woman will come. She had one particular doctor she loved so much. Every day she buys Fanta and meat pie for that doctor. Very handsome doctor. I think she likes the guy. So
Okay.
at one point she went home got a bus limo, carried all her mattresses, and came to the hospital.
Wow.
I kept telling her, this woman isn't. I know, but when I realized something, she felt she has lost 4 babies. And this one, she has her life that want to sell the baby. That's why she came with her mattress. She carried that day. She passed me. I saw the bus passed me in the hospital. I was like, I saw mattress. I saw Ghana must go. I saw this. The loss of those 4 babies made her, she became. I think she was almost getting tilted into psychosis. We invited the psychiatric. Whenever the psychiatric team comes, that's when she's at her very calm time. So you'll see her, to talk to her. She's talking very sane. She's a master's degree holder. But when they go, that whole episode comes up. But now she had a previous event that triggered her, and so that's it. And then as a social factors, as I talked about, then the woman who has had a child being managed in the newborn unit. I'm a pediatrician. I'm working in the newborn unit now. I have premature babies. Most of the time, when you're talking to the mothers, it's as if you're talking to yourself. I don't have so that's why I came a bit late. Their babies are not. These women, they've carried the baby for 9 months. They want to go home after. They want to come to hospital. They want to put to bed. They want to go home. But now something happens at the point of delivery. The baby comes out not very okay. We get to admit, and they stay like 3 weeks extra. People at home are waiting for the baby to come back. They don't care what's happening to the baby. So this woman has a lot of things around her. She has engorged breasts that are paining her. She can't breastfeed her baby. She has her people at home waiting for her. She has in-laws who are not supportive. That's very, they don't care. I feel like when the husbands are abroad, I have 2 men now, their husbands are abroad, they don't care. The husbands are sending people to the hospital and talk to us, and we can't talk to them. So most such women get to have this. As one of them, we're talking to her, she's off. When you ask her to give you a feedback of what you said, she'll tell you that whatever you said now that she wasn't here. You see, then they go back to the ward, they're not producing breast milk, they don't sleep well. The nurses will come and tell you that woman in the ward is not sleeping. The nurses from the ward will come and tell you, but these are the signs and symptoms of depression. So most time what I do is that I tell them, yes, we don't do infant formula in our newborn unit, but when I see such mothers, I tell the nurses, see, let's allow this woman. She's going through a whole lot. I try to invite the family members and tell them it's not this woman's fault that her baby is on admission. The baby is sick. Can you give her some help? Sometimes I send the woman home. We'll do maybe infant formula for some time, and after time the woman will come back. You see her, she's much more cheerful and much more. Maybe she had the baby blues, almost tilting into depression. So social factors, environmental factors, and then the hormonal factors play a very big role in postpartum depression.
All right, thank you. Do you have anything to contribute to all that?
Yeah, well, in addition to what my colleagues said, I was really happy when she talked about sleep deprivation. That one is actually one of the it's like we said, it's not like causes, it's one of the symptoms. And that's one of the weaknesses in a new born mother, yes, a new mother. So the aspect of the sleep deprivation, the truth is this: the woman a lot of things will be on her head. Her eyes will be wide open, morning till night. She won't sleep. During the day that she's meant to sleep, nothing is happening upstairs in her brain. She can't even picture anything because she was deprived of sleep. You understand? Then another aspect of this lack of support. Like we said, I have a case, my own case. I have supportive family. What if a case you don't have a supportive family, or you are coming from an abusive home? Okay, let me give an instance. A woman who have given birth to 6 girls, and the man said you must give birth to a boy. You gave birth to another one. Now the 7th one is another baby girl. She will go into depression. That's the truth about it. Because remembering what she will face at home when she gets home. You understand? Sometimes their husband leave them there and run away. Abandon them in total. They won't even come to think about and look for them. That's the truth about it. So that lack of support has a lot to do in depression or postpartum depression. Then, like I said before in my previous talk about stressful events. If you have a stressful event, you get home, you don't have somebody to support you, you don't have a house help, for instance, somebody to even to help. Every time you come back, you'll be very tired. But when you remember that it's still you that will get up, pick up that water and drink, go to the kitchen and cook, and the depression goes into another thing altogether.
All right. Thank you very much. It has been a wonderful topic. But before we continue, let's quickly go on a short break. I'll be right back. Thank you. Welcome back, viewers, from that very short break. Before we went on that short break, we talked about the causes of postpartum disorder. So now we'll be discussing about real life cases. You've given us real life cases, you've given us examples of, okay, actually I had one. I witnessed one, a lady that gave birth. During the pregnancy, she was very happy and all that. But actually, I felt that maybe she was not emotionally prepared to have a baby. But she was excited that she was having a baby. So after the baby came, like there's this changes. She changed totally. She was complaining, the baby cries a lot. She cannot sleep. She added weight. Her skin is saggy. Like there was a lot of complaint. And her husband was not always around. He goes out to work. She started, like you said, that I think her own went from baby blues to depression because it was not just that first few weeks of delivery. It continued. The husband will come back from work sometimes. The baby, she might even take her baby and go and dump the baby in the kitchen. She'll lock the kitchen door so she'll be able to sleep. She was complaining about everything that she's just changing. She don't know the reason. Even when people try to tell her that something was wrong with her, she said nothing is wrong with her, that she's fine. Until they met a what is it called? Yes, a psychologist. So she was not the one that put her through that process and everything. No, now let's talk about real life experiences. The ones you've seen, the ones you've encountered, how did the patients react to it? Did they actually accept the fact that there was something wrong with them? How did they manage that process?
Okay, I would have loved people who had real life experiences to tell, but as a doctor, in vast majority of cases, you find that these people tend not to agree that they have a problem. That is just it. And second of all, you see, when someone is overwhelmed, even when it doesn't have to do with PPD, people feel like it's better they say, I am fine, I'm okay. It's very difficult for people to speak up when they're having problem. And this takes me to make it a generic thing when it comes to speaking up when there is a problem. So from that point when you are overwhelmed, and most times you find that most people who are always excited when they are yet to give birth to a baby or when they are expectant, and when it comes with a lot of challenges, it comes with a lot of work, it comes with a lot of things for them to do. So they see it as something that, oh, I don't think I was prepared for this, I don't think I'm able to do all of this. So at that point it has gone beyond the level where when you come around they tell you I'm fine, and they start becoming aggressive. So at first, when they tell you they are fine, they are still living at that denial state. No, now from the denial, you see them getting aggressive, and at that point, if nothing is done, it takes, just like my colleague said, is a spectrum. At the level of baby blues, most times you see them living in denial, and that is what we see in the hospital. Because then we are trying to find out, why is this woman behaving like this, something different from the way she used to behave. So, but when it gets past that level, they become aggressive, and if nothing is done, then it can tilt towards psychosis, and it becomes a bigger problem to be managed. So maybe when we talk a little about how these things are being managed, you find out that at different levels you have different things that you need to do. So at that level of a baby blues, when you have doctors, and that is why most of us as doctors, we encourage doctors who are going to be so emotional while they are being empathic. So it's very possible that you are able to give that psychosocial support that these women need, because that can help pull them out from baby blues. So I know this is something Dr. Chimdi does a lot at FMC. When you keep talking to these women, it's a lot of therapy on its own. It can help them. But when it goes beyond that, that is where you see maybe the use of antidepressants and some other agents comes into play. But at that basic level, this can actually help them. So denial is a thing, but we need to understand that with time, if it is managed properly, they get better.
All right, thank you. So when you talk about speaking up, it's not like most of them don't want to speak up. But this society that we live in is a society whereby, especially we Africans, we feel that when someone tells you that this is goes to some certain people and say, okay, this is exactly how I've been feeling ever since I gave birth. Like it's normal. That is not a problem. You're not the only one. Or when you complain too much about it, like, are you the first person to ever give birth to a child? And then it tends to make them withdraw. You don't know who you tell or who you will talk to that will actually make you feel like Yours is different. So now, how do society come into this in terms of supporting those mothers?
Okay, thank you very much.
Yeah.
To answer the question, I would like to really commend the Igbo culture for something they've done very well, for a very good. Not every cultural practice that is good, but one very important cultural practice which the Igbo people have really done that is very good is the Omogo. Mogo, it's one thing that has really helped us to really curtail this postpartum depression, though we still have it. Now, this is a woman who was happy with her life, okay, let's say first pregnancy, because it's very common in first pregnancies and very common in very young mothers. I just come out living my life. One man came from nowhere, swept me off my feet, got me pregnant. I was still living my life, eating what I want to eat. Then pregnancy came. I can't eat anything. I have to just choose what I have to eat. Then suddenly, the 9 months, one tiny human being comes out of you and changes my life. Cries unnecessarily. I'm looking at you like, where is this person coming from? Then I have the people expect me to bathe this baby, expect me to give my life for this baby, and then suddenly I have no support. I have to resume work. And then that's why I also commend the civil service for this 6 months maternity leave they give. And also paternity leave. One thing about it, we always talk about mothers.
We don't talk about
Do you know we
fathers.
have the percentage of postpartum depression in men?
Yeah.
I think I saw about 5%. I think I saw it on Cleveland Clinic. I think that's the 5% in men. So I also want to commend. You can even move the men's on to about 4 weeks. It's good. They give them just 2 weeks. But I think Lagos does 6 weeks, but Imo does other states do 2 weeks. So now, what the society helps, as I said about it before, is the Omogo and this maternity leave, and then we health workers being more empathic than sympathetic. That's sympathetic. For us want to have sympathy, I'll tell you, hey, yeah. For us want to have empathy, I'll tell you, hey, yeah, and also want to help you to bring up a solution to what you're having there. You come to the ward, you understand. A mother is not producing breast milk. Maybe I come for my ward round every day. Nurses will write for me, breast milk not available for my baby. I come the second day, not available. I go to look for that mother. Madam, what's the problem? You understand? I found out that most of them, they are overwhelmed. They don't even know how to express. Come to them, their breasts are engorged. They don't know what to do. You understand? Okay, madam, there's everybody around you. No, there's nobody around them to really help. That's where the support comes into place. And then they have pain. Maybe some of them had CS, most of them had episiotomy. You see, there's so many factors in this whole thing. So coming to the society, health, let's start from the first place. They are in the hospital. The health workers will have to be I want to just say, at least as many of them that will see this video, as a health worker, be more vigilant. Look at your mothers. You understand? A woman who wakes up in the night crying, a woman who just stays. And I don't think a mother would want to see her baby hungry. But for that mother to stay and she's not bothered, please stop. Tell her mother, ask her what her problem is, and don't be judgmental. You understand? Let her open up. Most of them will talk to you, realize that this woman is entering depression. The woman does not sleep, loses interest in previously. Maybe this is a woman that likes watching TikTok videos, and so you see her, she's not even pressing her phone, she's not, look out for, most times I'll be in the ward, I'm doing my ward and the mother comes, I'm looking at her, I'm doing my round, I'm looking at her, I notice some changes about her. A woman who you've seen her previous pictures, okay, something happened one day, I had a patient who's is a sister-in-law to a friend. This woman was looking very haggard in the hospital, but when she put to, okay, her sister-in-law puts her picture on the status, and I had to ask the sister-in-law, Jennifer, is this I called the woman. I said, wait, that's your sister-in-law. I need us because I got to work the next day. I called the woman. I realized her husband wasn't coming around. Her mother, I think there was an issue between her husband and her people, so her people were not coming around. So any day her husband doesn't come, she has nothing to eat. She was not combing her hair, she was not beating. You see where the family support comes into place. And then the society not being judgmental. If you see somebody, everything no be spiritual problem. No carry and go church, no carry and go white. No. Everything is not spiritual. Sometimes just word. That's when you have this behavioral, what CBT, cognitive behavioral therapy. Just talk to them and they are good. You understand? You don't need to give them. Most times, just talk and they are fine. When you now become judgmental, who they talk, they keep it within themselves. From there, they can go from depression and get into psychosis. And when you get psychosis, you now start using drugs. And most of these drugs, you can't use them when you're breastfeeding a baby. Most drugs you use, most antipsychotic drugs, you can't use them for a breastfeeding mother. See, that will end up worsening, like a vicious cycle. Worsening the woman's situation when she knows that she cannot breastfeed her baby because she's on a drug. So we have a lot to do. But most importantly, let's just be non-judgmental. Let's encourage the mobile practice, and let's encourage the maternity and paternity leave we give parents. Yeah,
All right,
thank
thank
you.
you very much. Thank you very much. I'm actually happy you talked about a lot of medical practitioner in regards to assisting your patients, mothers, and because there are some medical practitioners, there are some hospitals you go to and they don't care. They don't care. That is it. I had experience firsthand. They don't care. They'll tell you if the baby is crying, hey madam, stand up and breastfeed your baby. Why are you lying down there? Something is going on with you, something is wrong with you, you know it. Maybe at that point, maybe you're just looking for someone to talk to, someone to explain this is exactly what I'm feeling. But when they don't care, when they act like they are not, it's not their business. You have given birth, they've done their job, and at the end of the day, if you like, take care of it. If you don't like, take care of your baby. So I think there should be more emphasis when it comes to that. A lot of medical practitioners in the hospital, there should be more emphasis on them on helping new mothers, because some of them have not even. Yeah, that brings me to um um what is it called, prenatal or antenatal, what is it called, before
Antenatal.
delivery,
Antenatal.
antenatal before delivery. A lot of mothers, I think a lot of mothers should be taught a lot of things before delivery. They should be taught, like giving lectures and a lot of things before delivery, because some of them have no idea, they have zero idea of what they are going into. That having a baby is not all about the beauty of it, the yes, I'm having a baby and I'm pregnant. There's a lot more that comes with having a baby. Get them emotionally prepared for what they're about to face. I think if a lot of them are being put through this process, it will actually reduce a lot of this mental disorder. What do you think?
Okay, I think I agree with you at some point, but I still disagree at some point because when you look at some of the factors that brings about this, it is like something that comes from both ends. So, having been someone who worked in a tertiary facility where we expect women to come for antenatal at the right time and learn what they're supposed to learn, and after a while in 2023, I decided to move down to the grassroots. So I've been working with a primary health care facility in the community. I see firsthand how a lot of women are nonchalant with most of those cares. So they don't even, some of them come when the lectures are over. And the same thing happening tertiary facilities as well. So in that situation, whatever thing that is being taught, they are not there to listen. They are not there to learn it. It becomes a problem. But to the other end, where I say I agree with you, I still believe that I have some of my colleagues. That's why I think in our medical curriculum, we need to, incorporate some level of psychology in as much as we have that, but it is not pronounced in a way that medical doctors, nurses, and some other healthcare workers need to know that psychological support, that psychosocial support is very important. Everything is not about chemotherapy. Everything is not about, madam, take your drug, leave the office, and all of that. There are some certain things that has to do with you as a medical personnel talking to these people. It helps them a lot. So in that area, I think I agree with you, and I think that's one of the reasons why we're having this conversation now. People need to understand. If people are listening to this, they need to understand that yes, this is what is very important. And to women out there, for you to run away, for you to get rid of this PPD, you need to make sure that when you are giving appointments, come around. If we say now we are going back to the traditional eight times before birth, now just make sure that you attend the antenatal care clinic, get the information. It is really going to help you go a long way to be a better mother in the nearest future, because this is something that happened within the space of 9 months. So you are moving from this person to another person. So it will really help.
Thank you.
Okay,
Your final thoughts on that?
Yeah, in addition to what my colleague just said now, because I want to disagree with you also in the aspect of antenatal. The truth is that I'm a mother of, okay, let me just say four. I always say four because I've actually carried four pregnancies, you understand? In as much as I lost one, I don't need sympathy,
It's all right.
so actually that one what actually gave me the depression from birth to death. Can imagine that. So, but let's not talk about it because we're on air. So, the antenatal issue. The truth is this. I wouldn't say no hospital don't give lectures on how you handle your newborn baby before and after birth. But like my colleague said, most of us run away from it. Let me use myself for instance. Maybe during my second pregnancy, I've already had I'm already an experienced mother. So I know what it is and the symptoms. I feel I don't know the symptoms of pregnancy. I neglect my antenatal. What I do is when I pick up my number, I start at home. Imagine the time that maybe by this time 12 o'clock, maybe from number 10 for instance, by 12 they should be attending to number 5. Okay, let me just dress up. By then I've actually missed my antenatal. So will you blame it on the medical practitioners? No, no. Then my advice out there to my fellow women there is this: please let's find a way to be open, talk to people. In as much as we have disappointments, but don't be feel because you have disappointments or this person have disappointed you or this other person have shared my experience with this person. She went ahead and was talking about no. Depression kills. That's the truth. It kills. But when you're open to people, I feel you will get the right person that will counsel you. Counseling is the best. Like my colleague said, there are some medicines that a pregnant woman or a breastfeeding woman cannot take. What that person needs is counseling. That's where psychologists come in. So thank you.
All right, thank you very much. It has been a wonderful program in the house. To our viewers out there, you've heard what we discussed here today. So, if you are going through something like this, or you know someone who is actually going through this phase, do well to talk to them, get to know what they are going through. Don't keep them quiet. Listen to them, hear their own part of it. And if you are experiencing it, try and see a medical doctor or a psychologist, someone that could actually help you pass this phase. And please, to our families and friends out there, please be supportive. To the society at large, be supportive. Do not discriminate. Thank you very much for watching. God bless you. Until we come your way next time. Bye. Take care.
Thank you.
Thank you.
Bye.